Hello, my name is AFNAN. I will be presenting the physiological and therapeutic effect of ultrasound. So first we take a look on physiological effect. So under physiological effect, there is a thermal effect. So this is happen when the ultrasound travel through the tissue. The percentage of the ultrasound itself will be absorbed and it is lead to the generation of heat within the tissue. The absorption is depends on the nature of the tissue, degree of vascularization, and the frequency and output of the ultrasound itself. So let's take a look on the thermal effect. Thermal effect, thermal also mean heat. So this effect is correlate with the rising temperature during the treatment. So one of which is the rising temperature. See, so when the temperature rise, it will cause the vasodilation, means the blood vessel will dilate in the area of the treatment. Then, as a result of the rising temperature, viscosity or the thickness of the fluid will be decreased, and then the increased temperature also will increase the chemical reaction. In other words, it will increase the metabolism rate. Uh, the rise of temperature also affect the collagenous tissue. It will increase its extensibility and reduce joint stiffness. Finally, this rise of temperature also affect the nervous tissue. It's, it will give an effect of analgesic effect, also known as a pain relief or reduce the pain. As a result of this effect, it will reduce muscle spasm. So aside from thermal effect, there is also non-thermal effect. So this effect does not include the rising temperature. So this effect, one of which is cavitation. This means the formation of gas or bubble within the tissue during the treatment. So there is a two type of cavitation, stable and unstable. A stable cavitation is where the bubble oscillates up and down, but it is still intact. A stable cavitation can enhance acoustic streaming that we'll discuss later on. So this cavitation is not dangerous. Meanwhile, unstable cavitation is potentially dangerous, where the bubble will increase in diameter and it can implode and damage the tissue. So, for caustic streaming, it is a small scale of eddying or circular motion of the fluid or gas bubble near the vibrating structure such as membrane. This will cause unidirectional movement of the tissue, and it will affect the diffusion rate and membrane permeability. Lastly, we have micromassage. The sound wave traveling through the medium is claimed to cause a molecule to vibrate, possibly enhancing tissue fluid interchange and affecting tissue mobility. So, aside from the physiological effect, there is also a therapeutic effect, which is the direct cause from the thermal effect itself. So, one of it is the blood circulation. So, from vasodilation, it will dilate the blood vessel, as we discussed earlier, which is widening of the blood vessel. Also, it is because of the lower viscosity, which is the thickness of the fluid or the blood is lower, so the blood can flow even better, which which lead to better circulation. Then from the acoustic swimming, it can increase membrane permeability and diffusion rate even better, which can cause our body to function easier and enhance our functionability. And finally, muscle relaxation is the cause from the thermal effect again, which is the analgesic or pain reducing that cause muscle spasm to reduce. So this finally can make our muscle be more relaxed. So that's all for this video, and thank you for watching.